Professionals at Novant Health here in Charleston say hip replacements are quicker and safer than ever, and they encourage patients to get it done younger if you can. Summer Hector shares how the surgery changed the life of one Lowcountry father and athlete.
The joke around here is that it's not your grandma's hip replacement surgery anymore. The orthopedic surgeon I spoke to here at Novant Health says it's because people aren't waiting until they are grandparents to get it done. At just 40 years old, a Lowcountry man, Jason Thomas, is a perfect example of that.
My kids are really young right now, and I was having a really hard time just running around with them, crawling around with them, wrestling with them, and it gave me the ability to do that again.
Jason Thomas lives in Mount Pleasant with his family. As a former college and professional football player, he said he's been really hard on his body for a long time. He had his first hip replacement at 34 years old and the second this past year at 40. Both were done by Novant Health's orthopedic surgeon, Dustin Hambright.
Things have changed quite a bit since my residency. Patients would come in, they'd be there for a week. I remember them being on a pain pump. We'd be doing post-op day 4, post-op day 5, they'd be in the hospital. Now people are coming in the same day and they're home for dinner.
I think that day of surgery, I got in at 11 a.m. and I left by 3 p.m.
Dr. Hambright says it's a much quicker process now because of advancements in technology and computer assistance. He uses computer technology to help measure and map out a lot during procedures. But he says the reason they're able to get people home quickly now is because of their perioperative management of pain.
You know, preoperatively, we give them medications before the pain receptors are hit during surgery. And then during surgery, anesthesia does a spinal anesthetic, which helps the pain control. So when they wake up post-op, it's sort of a slow feeling of increase in pain. And then post-op for the pain management was sort of also like multimodal. You get a muscle spasm medication. I get a sort of pain medications for each level: moderate, severe pain, and then just regular Tylenol can help as well.
Thomas said he was back working out within 4 weeks of his last hip replacement surgery. That's while still doing physical therapy. But around 3 months post-op, he says he started back boxing. That's what he loves to do right now. He actually won the Battle on the Bricks charity boxing event last year at TD Arena.
Now that I'm 6 months out, I'm back to sparring, I'm back to running, I'm back to training a couple times a week. And again, I'm not a professional boxer, but I like to do it for fun. So.
Jason Thomas said he would love to get back in the ring and compete again in the Battle on the Bricks event at TD Arena at the College of Charleston. He said hopefully next year. In Mount Pleasant, I'm Summer Hector, Live 5 News.